Good morning, good afternoon, and good evening. Can you all hear me? Abena, can you confirm if you can hear me loud and clear?
We can hear you, Grace. Thank you.
Thank you. A very big welcome to Pharmacy in Action, Advancing Health Literacy and Equity Worldwide. This is the sixth and last event as part of the FIP Advocacy Series on Health Literacy. It's really inspiring to see colleagues and partners from every corner of the globe joining us today, and thank you for joining. The specific theme for this event is Innovating Pharmacy Practice for Elder Communities, a focus on the Western Pacific. My name is Grace Adebayo. Work with the FIP as the FIP support coordinator for project and data, and I'll be facilitating this event today. Thank you. So before we start, I would like to share some announcements. The webinar is being recorded and live streamed via YouTube, and the recording will be available on our website at events.fip.org. You may ask questions using the question box provided, and you're also welcome to provide feedback at webinars@fip.org. And if you would like to become a member of FIP, you can visit our website at fip.org/membership registration. We also have a translation tool in Zoom. If you would like to use this tool and follow the webinar in your own language, please turn on captions and enable the translation toggle. You can choose your preferred language under My Caption Language, and you can now follow along with the live translated captions. We would like to thank our sponsor, Allion, for supporting the project of this event. So moving on, I would like to introduce to you that this series was a six-part digital event series that brings together voices from all 6 WHO regions to share practical, innovative, and impactful ways pharmacists are advancing health literacy in their communities. As mentioned earlier, this is the 6th and last session under the FIP advocacy campaign for health literacy and equity worldwide. And today we'll be focusing on the Western Pacific region. Central to today's conversation is the FIP's report, How Pharmacists Worldwide Are Strengthening Health Literacy and Empowering Patients. This report tells the story of pharmacists around the world, from community settings to hospital, who are helping people understand their medicines, navigate complex health information, and make informed decisions to protect their health. It also highlights the systemic barriers and offer actionable strategies to overcome them. As we dive into today's session, I invite you to think about the communities you serve, consider the ways you can apply these insights to empower patients, strengthen partnerships, and ensure that everyone has access to the knowledge they need to live healthier lives. The learning objectives for today's event is to, first of all, identify innovations in pharmacy practice that improve equity and health literacy, understand the role of digital health tools in expanding access to services, and also share practical strategies to create more resilient and healthier communities. This is today's program. We'll start with a welcome and introduction, followed by a global and regional overview based on the survey and interview findings from the report earlier mentioned. Then we'll move on to an interactive activity. Please join this activity and share your comments and thoughts on the specific questions that will be provided. We'll also continue with the call to action specific to the Western Pacific region. And after that, we'll have a Q&A session. Please feel free to ask your questions to our speakers through the Q&A box. And finally, we'll close the event with final remarks from the speakers. I would like to also highlight that the FIP development goals are essential in all FIP programs and link the program delivery to the FIP vision and mission via regional and national needs, underpinning all the FIP work to 2030. Development Goal 10, Equity and Equality, which is in line with today's webinar on health literacy, is composed of 3 elements. First of all, we have the workforce and education elements, which sets out clear strategies for addressing equity and diversity inequalities in pharmaceutical workforce development, continued education and training, and career progression opportunities. We also have the practice elements, which provides clear strategies for equity and diversity in pharmaceutical services delivery, service access, and service impact so that all people have access to quality pharmaceutical care. Then lastly, we have the science elements, which provides equity in global capacity of pharmaceutical sciences training, also research infrastructure, development and manufacturing capabilities, and evidence-based regulatory oversight. And now let me go ahead to introduce our speakers for today. First of all, we have Dr. Charlie Chang, is the executive advisor and previously the president of the Taiwan Society of Health System Pharmacists and president-elect of the Federation of Asian Pharmaceutical Association. He brings over 30 years of leadership experience in hospital pharmacy and regional collaboration. He has driven major advancements in digital health, smart medication systems, and national drug shortage management, significantly improving access, equity, and supply resilience. Thank you and welcome to today's session. Secondly, we have Mr. Jack Shen. He's a community pharmacist and the General Secretary of the Malaysian Pharmacists Society. It's a career spanning hospital pharmacy, industry, community practice, business development, and digital health. He works at the intersection of preventive care and pharmacogenomics, consulting for the Global Precision Diagnostics and co-chairing MPS Preventive Care Framework. Jack also holds regional leadership roles within FAPA, FIP CPS, and FIP Western Pacific Pharmaceutical Forum. Thank you. Welcome to today's session, Jack. Lastly, we have another list. We have Ms. Leonila Ocampo. She's the chief operating officer at Mobi Pharmacy in the Philippines. She has served as president of the Philippine Pharmacists Association for 4 years, where she led organizational reforms and contributed to the passage of the 2016 Philippine Pharmacy Law. She has also held other key advisory and technical roles in pharmacy education, continuing professional development, and healthcare policy, and is also the recipient of multiple awards, including 2 Lifetime Achievement Awards and the FIP Fellow in Pharmacy. She currently serves as Secretary for Pharmacy Practice at FIP Western Pacific Pharmaceutical Forum. Welcome, and we look forward to your insights today. So I'll go ahead and hand over to Leonila.
Okay.
Yeah, to take the question that we asked while registering for this event. There was a question we asked to all participants, and she provide oversight. Thank you, Leonila.
Okay. Thank you very much, Grace. Thank you also, Alvina. Good day to my fellow sharers or speakers here, Jack and Charlie. And of course, to all our participants who are with us now online. So good day, good morning, good afternoon, and good evening, wherever you are in the world. So prior to this event, there were some surveys or questions that were sent out, and let's try to take a look at this particular question that is on the slide. So it says, what innovative approaches in pharmacy practice are helping to create healthier communities in the Western Pacific region? So this is one question that we have routed out, and we were able to get the following things that you also would see that follows to the question, some of the feedbacks or answers given by the respondents. So you would find that digital health solution is one that was recommended. So it says here that it's important that artificial intelligence should be included and modernized system in making the operations also efficient. So these are needed because we need them to support medication safety, clinical decisions, and patient monitoring. Some also answered that telepharmacy and teleconsultation platforms, these are important in order to improve access to pharmacy services particularly in rural or underserved communities. So this is one item or one topic that we normally are always saying as one tool that could improve how we could expand the services that we're giving to our clients. Then another answer that we're able to generate is pharmacists are expanding patient-centered care through services such as medication reviews, screening, counseling, and antimicrobial stewardship. So very, very nice answers given as to how we could introduce some approaches to make our practice be better in our region. Another one says pharmacies-led vaccination services is another way of how we could expand and make our practice be available in the region to create healthier communities. And this is to include adult immunization that would enhance preventive health care and definitely would also contribute to building healthier communities. And the last that we see here listed is health education and community outreach initiative. We look at this, or our respondents look at this as empowering tools to also empower our individuals or our clients with accurate information on medicines, lifestyle changes, and disease prevention. Now, there may be some that you would like to later on share. We will come to a point where we will have some interactive activity where we will be asking you some insights, some inputs from you. Now, with this, we will proceed by me forwarding or giving it to Jack for the next things to be shared to you. Please come in, Jack.
Thank you, Ma'am Yolina, for taking us through some of the valuable feedback you, our fellow colleagues from all over the world, and then especially in the region, to have submitted as part of our pre-event insights. I hope you guys can hear me just fine. Good morning, good afternoon, and good evening. Once again, I am Jack Shin Lim, and I'm the General Secretary of the Malaysian Pharmacist Society, as well as Treasurer and Vice President of the FIP Western Pacific Pharmaceutical Forum, where I'm sure many of you are interested to know what's happening with regards to health literacy and how pharmacists can play to improve that. So looking at the global overview of the survey findings, as you can see in this slide, we actually collected this information for 149 pharmacists across different regions of the world. If you take note of some of the statistics that appeared, you can see on the first ring-looking diagram rather, on the left, pharmacists, about 72% of pharmacists reported of being involved within the past year in public health activities. The most common areas of involvement that have been highlighted include medication safety and adherence, infectious diseases and vaccination, and chronic disease management. And if you look closer and you look at who leads these activities, most of these campaigns are actually self-initiated or community-led, which is good. Then basically it shows that there is a community-centered and pharmacists are taking an initiative to actually lead activities in their communities. These are followed by initiatives that's led by the National Ministry of Health or even national pharmaceutical associations like the one I'm representing from Malaysia. And again, this shows, well, I'm repeating myself a little bit, it shows that we are actually taking advantage and taking initiative at the community level with our close links to the people we serve. And we are doing it without formal structures, and that is actually a very good organic activity to promote health literacy. However, unfortunately, when we look at the use of technologies, it only shows that 28% of pharmacists use these digital tools regularly, 45% use them occasionally, and about 27% use them not at all. Okay, so if you look at that, this is the middle part below the map. And it shows a opportunity that's available for pharmacists to strengthen digital integration in health promotion and service delivery to the communities that we serve. Okay, if now you look on the right side of your slide, on the right side of the screen, you can see that we have identified some barriers of engagement in public health activities, and the main challenges um, limiting pharmacist engagement are both structural and motivational, right? If you look at that, the first three of them, number one is the lack of time to participate in campaigns, because we know how busy pharmacists are at the community pharmacies and the community level. On top of that, we have a lack of incentives and recognition, and we have limited institutional or employer support. Now, let's look into a little bit more on the findings. Our findings identified 5 key clusters of support and training needs. These are the needs that pharmacists need to be supported in order to perform our role in public health and health literacy. Number one is tools and resources to be made available for them. Number two is skills and knowledge development with regards to areas of interest in public health. Recognition and accreditation is very important. Not all pharmacy efforts are recognized at the national level or the health system level. That's something that we want more of. Collaboration and networks of always multidisciplinary care and collaboration needs to be improved. And last but not least, structural and system support. So now if you take a step back and look at the whole picture, in summary, while pharmacists globally are showing a strong willingness to contribute to public health, our impact is often constrained by either the system, which is a systemic barrier, or resources available that have been made available for us to contribute. So if we can strengthen institutional support, incentivize participation of pharmacists in public health, and expanding the training opportunities so that pharmacists know what's going on and what they need to improve on, then we can significantly enhance our public health engagement, and doing so, doing a major contribution to our health systems locally as well as globally. It is a lot to take in, I understand that. This is actually the global overview. So let us zoom a little bit more into the Western Pacific region. And to that end, I'll hand over to my colleague from Taiwan, Dr. Chang. The floor is yours, Dr. Chang.
Okay, thank you, Jack. It's my great pleasure to join this webinar, share some insight and experience from Taiwan. So following Jack's general overview, so right now this is a general overview of the survey and the interview findings from the Western Pacific region, focusing on innovating pharmacy practice for healthier community. As you can see, these findings are a snapshot of pharmacists' engagement in public health, the barriers they face, and the opportunities to strengthen health literacy through expansion of services and case example of participating countries. Next slide, please. So in the Western Pacific region, we had participation from 18 pharmacists in the survey, representing about 12% of total respondents. From 6 countries, Australia, Taiwan, Japan, Malaysia, New Zealand, and the Philippines. A larger majority, 83% of respondents, reported participating in public health initiatives within the past years. Among them, as you can see, around 46.7% joined 3 or more initiatives, 20% joined 2 to 3 initiatives, 33% joined 1 initiative. The most common area of involvement were medication safety and adherence, chronic disease management, followed by smoking cessation program. Other areas, including equitable access to healthcare and medicines, infectious disease and vaccination, and mental health awareness, each reported as 10.5%. However, pharmacists highlight several barriers to participations, such as lack of time to participate in campaigns, followed by lack of incentives or recognition, and low public interest or uptake. Other barriers including limited institutional support, lack of awareness of such opportunities, and insufficient training on health promotion. These findings highlight both the enthusiasm of pharmacists to engage in public health and the systematic barriers that limit their full involvement. Next slide, please. So from the interview finding, several examples of pharmacy-led public health initiative across Western Pacific regions stood out. Starting with Taiwan, pharmacists play central role in national public health responses, most notably during COVID-19, where they help manage mask distribution and provided community education. They also delivered structured diabetes consultations and development a standardized prescription drug labeling database, which significantly improved medication safety and patient understanding. And in South Korea, pharmacists has been leading major nationwide campaigns on safe medication use, generic substitution, antimicrobial resistance, and overall medication safety. They also implemented polypharmacy management pilots, transition of care program, public health festivals, and even anti-doping activities, showcasing the breadth of pharmacy-led public health interventions. And last but not least, in Kuwait, pharmacists coordinated impactful nationwide campaigns such as adult varicella vaccination and inhalation technique education. This effort used community outreach, surveys, and media engagement to demonstrate measurable improvements in awareness and clinical practice. Across these countries, we see a consistent theme: pharmacist-driven population-level impact by combining education, service delivery, and system-level innovations. Next slide, please. Findings also revealed key challenges in government funding. Workforce shortage and time pressure further reduce their capacity to engage patients meaningfully. In addition, equity challenges such as language barriers, poor access to interpreters, and weak digital infrastructure create gaps in service access. Finally, public distrust of generics and digital misinformation undermine pharmacists' effort to provide accurate and reliable health information. Despite this challenge, there are significant opportunities to build on. Medication review and optimization. Pharmacists support patients manage multiple medicine, chronic condition, and aging-related needs through counseling, adherence, support, and targeting interventions. Preventive health and lifestyle promotion. They play key roles in smoking cessation, nutrition, physical activity, and other self-care initiatives to strengthen public health. Expanding role as trusted health educators. Pharmacists leverage their accessibility and public trust to provide health information, participate in outreach activity, and engage priority populations through culturally tailored approaches. In summary, the Western Pacific region highlights pharmacists' critical and expanding role in improving health literacy, strengthening preventive care, and enhancing patient outcomes across diverse health systems. So that's all in this interview and all our findings. So let me back to Yuh-Lih. Thank you.
Okay. Thank you, Charlie. Thank you so much for the very good insights and report of the survey results that WPR has done, or the Western Pacific region has done. So with what has been shared by both Jack and Charlie to us, we have seen how pharmacists, especially community pharmacists, could significantly contribute to national public health programs, how we could really help make it better in terms of helping the capacity or capability of our clients to understand certain health information in order to be guided to better or good health decisions. Now, all this directed towards coming up with or envisioning to have better outcomes of medications that our patients are using. Now, also in the sharing done by my two colleagues, we also have heard that there were a lot of challenges encountered, and all of these challenges are actionable. So it's a matter of us really coming up with a good plan on what we can do as pharmacists and give our share of how we could improve and how we could fight head on the barriers encountered, so we would be able to move forward and really be a contributor to improve services to better health outcomes of patients that we're serving at the community level. So we will now be on our interactive activity. So I would like to invite everyone. We have right now 88 fellow pharmacists joining us in this activity. Now, please join us to participate in this conversation. So I will be reading questions, Jack will follow, and Charlie too. And I would like to request you to make use of your device to enter the code of the slide.com or scan the QR code on screen. And please submit your responses to the questions in English. So we'll try to process whatever responses we'll be able to generate or gather as you would all be giving your insights, your inputs. So the first question says, what should be the priority action to improve health literacy in your region? So let me invite you to now try to write your responses so we could discuss it here and share to everyone. Okay, so I've seen already a response on vaccinations and home review. So I would suppose these are actually home visits that a pharmacist could do to help review medications that occupants of a certain household are having. And then another that is shared to us is access to reliable health information. Now, fellow pharmacists, you and I know that there are a lot of things that one could read or generate from information online, and us being there available in the community should be able to guide our clients, our patients, and our fellow individual who are using medications and guide them to really interpret and be geared towards how the information could be better interpreted. Then recognition of pharmacists by doctors and healthcare system. Yes, I would agree very much with this answer, because it is important that everyone in the healthcare team should recognize the important contribution that the pharmacist could give. Now, remember that in most of the patients managed, medicines are used, and without a pharmacist, medicines would not be there. Then awareness campaigns, we need to take a lead on disseminating information, then let people know the medications they take, so counsel the patients on the appropriate use of medication. Another says use tried and tested behavioral nudges, framing and anchoring behavioral economics has so much to teach us. So this is another recommendation or answer that is given to us. Equitable access to digital awareness. So digital health actually is the way to go. Digital pharmacy is also the way to go for pharmacies. So we should be able to make use of whatever limited resources we have to just start even small with how we could do digital tools be used as our enablers in delivering our services. Then empower pharmacists to be proactive when it comes to patient counseling. Yes, I would agree so much with this answer. We do not need to always wait for one to ask us to ask us questions relative to the medicines that they're taking. When we are dispensing medicine, especially for patients who are for the first time coming to us, we should be proactively giving them the right information. Now, remember, it is us who is in the best position to really guide patients how to appropriately, how to correctly use their medications. As we all know, medicines would only be medicines if they are used correctly, and they could be poisons if not used appropriately. So these are some of the answers that we got from this question. So we still have some participants typing on their answers to the question. So okay, so one says pharmacists should also be aware on trends in medication safety and guidelines. Yes, that's why continuing professional education or continuing professional development is always to be embraced by each one of us. No, let's make this really a something that we have to commit to, that we want to be always updated with what are the new trends that we need to understand or we need to know in the practice of our profession. Clear, simple, and culturally appropriate medication counseling. Yes, right. We have to be talking, communicating to our patients in a manner that they would be. It will be to their language, meaning in a language that would be understandable to them. So no use of unnecessary things during the discussion. So we would be clearly we would be able to clearly disseminate the information to the patient. Then address barriers, whatever barriers that were mentioned earlier and any more that you might have encountered, then we need to address that. We need to resolve it. If we cannot resolve it ourselves, we ask the help. We ask the assistance of our fellow pharmacists or whoever could help us resolve these barriers. Proper collaboration between healthcare professionals for better patient outcomes. Yes, this is very true. It is important that we need to collaborate. We need to be able to discuss with our fellow healthcare service provider. After all of us is serving one and the same patient. So whatever would be the intention of one is the same intention of every one of us managing or serving the patient. Is the caregiver collaboration. So just the same as the other collaboration things mentioned earlier. So these are some of the things that we see as is contributed by our fellow pharmacists here of what we could potentially do to improve health literacy. Now, fellow pharmacists, just to also add a little more to what you had been saying here, we need to remember that we are the health professional that is in the heart of communities, easily accessible by anyone who may need some information and guidance, especially with the medications that they are taking. So we also have to remember that there are some information that would not be interpreted correctly by these people or by these clients that we have. They could easily get it online. They could easily just take a click in the keypad of their computer, cell phone, or mobile phones. But we need to guide them, and we need to bring them to the right information or interpretation of information that may be getting. That's why it's important that we would be closely collaborating and supporting our patients. So much for this question. We'll proceed with the next question. So may I ask Jack to please take over for the second question.
Thank you so much, Ma'am Leolina, again. We are just a refresher for everyone that's online. We are discussing about how pharmacists can do better and help the health system with health literacy for our patients. So the second question we have, and again, I would like to encourage everyone's participation, is how should pharmacists collaborate with other stakeholders to improve health literacy? I see participants being very good. Excellent. The first suggestion that came through is partnership with schools and local leaders to increase outreach. That is actually very important. For example, in Malaysia, we work together with our Ministry of Health to actually reach out to schools and local leaders on the Know Your Medicines campaign, and that's something that does improve medication literacy in Malaysia, and is an excellent suggestion to actually do this regionally in other countries as well. The second one, I think it reiterates my point, which is collaborating with government and health agencies. I think that is also very important. I think we have seen this regionally where pharmacists work with their FIP member organizations, which is their national professional organizations, to actually collaborate with the government and health agencies to get information. That is definitely very, very true. We also see a comment to establish more programs to reach communities. I think that is very, very important. To that end, I would like to also highlight to everyone the FIP's Think Health, Think Pharmacy campaign that is actually being done worldwide. I think that's actually a good resource for pharmacists to actually work with their local communities to establish such programs. We do have another pharmacist that talk about participating in multidisciplinary committees. That's actually quite important as well, definitely. I think this is actually a very, very important part for multidisciplinary care. Many hospitals are doing that already. I think this is something that we can continue improving in the Western Pacific region, and also to find ways where the local pharmacies can collaborate with their local GPs to actually get campaign out as well. Establish programs that may reach especially the underserved communities. I think that it's a very big established precedent in our region. In Malaysia, we have such programs. I think Philippines do have them as well, Indonesia, and another one of note is Australia, where they reach out to the Aboriginal and Torres Strait Islanders as well to have programs. Again, I think the Western Pacific is unique. We have a very diverse population with many languages all across the region, and a lot of minority communities that we can actually work with. I think as FIP, the Western Pacific Pharmaceutical Forum, we would welcome pharmacists from the region to actually give us more feedback on how we can actually support these programs across. Keep getting more of this feedback to come back in. collaborate with media to counter misinformation. That's actually very important. And I think the media in question is not only just the usual media we have on the mainstream media. We are talking about social media as well. There is actually a lot of social media that has issues with misinformation. And I think pharmacists in this space will be very, very important to counter this misinformation for things like anti-vaccine movements or the use of or rather the illegal use of medications or some in off-label. I think that's also quite important. I see more comments coming in. Another one is understanding the community-based issues. I think the community pharmacies do need to have a finger on the pulse, for the lack of a better word. And I think this is actually something that's quite important. Excellent. And to get that pulse, the next suggestion, engagement with patients and caregivers, definitely. And I think that's a very good comment from our colleague to say this. Because sometimes we focus on patients, we do forget about the caregivers. And so caregiver support would be very, very important. And that's something that I think as pharmacists you can work with. Yeah, just to keep it coming as well, we have I only have 2 more comments here. Partnering with other healthcare providers and health agencies, yes, we need to work with our colleagues in medicine, as well as nursing and or even dentistry. We don't exist in a vacuum, and I think linking up with the other professions to actually lead or even co-design health campaigns. Sometimes we look at it at a perspective from a pharmacist, but if we talk to other health professionals, we can actually see, like, for example, oral health with dentists, and how can the pharmacist support the oral health of our patients, for example. Another comment that came in is community workshops on chronic disease management, vaccination, and safe medication use. This is on point as well, colleagues. When you talk about the role of the pharmacist, chronic disease management is important. Vaccination is important for public health, definitely. And as medication experts, we need to look at safe medication use, definitely. I think that's all the time I may have for this question, but I do have one more comment that just appeared before I pass over to Dr. Chang for the last question. This comment from our colleague is to use pharmacies as health literacy hubs, offering blood pressure checks, diabetes screening, and counseling with easy to understand materials. Definitely on point again. I do want to say that we are also pushing a campaign to make community pharmacies the wellness hub as well. And so when we're talking about blood pressure check, diabetes screenings, we're talking about preventive care. So coming from preventive care all the way to the management of chronic care, that's actually where the pharmacists can excel in. So that's excellent. I would like to thank all our feedback so far for this question. Thank you so much, colleagues. I will hand over to Dr. Chang. It's a very lively discussion, Dr. Chang. Over to you now.
Yeah. Thank you, Jack. Thank you, Leonila and Jack, for very interactive and very great discussion, and also from the participant. So let's move to the third question. What strategies can pharmacy implement to make health information more inclusive and accessible? What strategy can pharmacies implement to make health information more inclusive and accessible? Yeah, actually, from my own experience working with patients in Taiwan and seeing the survey result from colleagues across West Pacific region, I think one of the most important things pharmacy can do is to design health information truly from patient's point of view. Yeah, I think it's the core. Yeah. So we can see from our participant, the first one is virtually engaged leaflet or digital posters. Yeah, it's important. Visually engaging, yeah, it's very important, especially for a special population, elderly, and also co-create with patient advocacy group. Yeah, it's also very good strategy to collaborate with the advocacy groups, and also train pharmacy staff in cultural competence and inclusive communication. Yeah, pharmacist training is very important, and you need to realize the patient's perspective. So cultural competence is very important, and inclusive communication. So we need to improve pharmacist communication skills and also engage with patient advocacy group to develop materials that speak to them. Yeah, also think from the patient's perspective. And yeah, and also many input and train staff to recognize available different. Sorry. Make health information available in different language. And make the health information available in different language for wider population coverage. Yeah, it's also very important, the multi-language, because right now, a lot of people, especially in Taiwan, we have a lot of caregivers, they are foreigners. So multi-language task is very important. And also improve communication skill and emotional intelligence. Yeah, it's very important. Yeah, all from patient's perspective, and also ensure digital platform, including apps, portals, meet accessibility standards. Yeah, it's very important because we need to meet accessibility, because maybe elderly, they are not get used to all this kind of newly technology. So we need to make them accessibility and visible. Yeah. And also no need to reinvent the wheel. Look for, review, adapt, and adopt materials from FIP and WHO. Yeah, it's because we know the FIP creates so many standard materials, and many materials we can take advantage from them. Yeah, and also host pharmacist podcast with other health workers and engage in discussions of updated health information. Yeah, it's also very good media to host a pharmacy podcast. And also, not only pharmacy collaborate with other health workers, because maybe we can learn from different professionals, and we can know more about the true need for the patient. And the host pharmacist podcast with other health workers and engage in discussion of updated health information. Oh yeah. Also, so updated health information is also very important. We need to because sometimes there's create more questions for new medicines. So the updated information very important, and also if the new safety information from old drugs is also we need to update it to the public, and also provide multilingual support. Yes, we just like previous comment, we need to think from the patient's perspective. If you cannot give them they are familiar with, so it's invent. We have a lot of great feedback from our audience. So I think in summary, the strategy, I think we should start from the patient's life experience, and we can co-design with them and test with them, because we need to, maybe if we have some strategy, we need to have a pilot study with our patient, and we deliver the information in a way that can truly access and use. I think that's how pharmacists can make health information more inclusive and generally supportive of health literacy. Thank you. Thank you for your great contribution for these questions. So let me give control back to Jack. Thank you.
Hi, thank you so much, Dr. Chang, and also Mom Leonina for earlier. It's been an excellent discussion. I'm actually floored, colleagues, for the number of comments and engagement that has come through this session, and I'm sure we will get more feedback from our colleagues across the region, and please continue to do so. So therefore, for us to go forward, this is actually a short call to action on focusing in our region, the Western Pacific region. I also want to take note that we have just recently welcomed a new country as well, Indonesia, from joining the Western Pacific. So basically, our campaign continues beyond this event, raising awareness amongst pharmacists, and later on we'll continue getting resources. And therefore, and for you as our colleagues from across the region, therefore, would love for you to explore digital or tech-based tools to improve patient care. Talk about telepharmacy, talk about digital consultation. There's so many things that we can actually put in. So do share this event recording across your social networks. If you do have questions, please put it in as well. I think, do we have time for questions? A little bit of questions, Grace, after this?
Thank you, Jack.
Mhm.
So from the Q&A box, I can see one question regarding how to integrate AI into pharmaceutical service innovation.
That's a very heavy question. I'll open.
Yeah.
Yes.
So maybe do you want to go, or Charlie or Leonila?
Sure.
Who would like to? Yeah.
Jack, would I be the one to give first?
Yeah, please, Mom
Okay.
Leonila, go ahead.
Okay, thank you, Grace. So the question on how we could utilize AI or how we could integrate it in the work that we do day to day. Actually, we're just newly we're having a group now who is into an initiative that we newly implement, utilizing EI as our enabler to make the operations more efficient and faster. So where is this taken? Where is this being placed? Practically in all steps of the process and how we operate, including in fact the pick and packing, the picking, how these are AI enabled. So the automated dispensing machine that is supported by AI, and then how the filtering of information, whether they are the right information that should be given or they are just misinformation. Of course, these are all managed by the pharmacist that is on board with the initiative that we're trying to do. So we hope this would come out to really be successfully getting to where we would want it be brought, because it's just newly done by our team. And hopefully one of these days I could share, because this is the tool we're using to make faster the implementation of the government's program now that we call YAKAP, or Yaman sa Kalusugan, Wealth for Health. So we're helping our government on how we can expand these services and to make things faster without jeopardizing accuracy and safety, accuracy in delivering the medicines and the services to ensure safety of our patients. We are embarking on this initiative, and hopefully we would be able to share to you whatever would be the result of this. Yes,
thank you so much. Yeah, thank you so much.
I'll quickly jump in something. Is that okay for me to jump in as well? Very quickly?
Yeah, very quickly. Thank you.
Yes. So I think one of the things you can use is actually the FIP AI toolkit. There is an FIP AI toolkit that has been published by FIP. In Malaysia, we are also adopting that toolkit for the local context. I think it's very important to remember AI is a tool. You are still a human being and decision making has to be the human, because there is things that, like for example, generative AI may have, like, dreams, they call it, where there are inaccuracies. So ultimately, as a pharmacist, you need to be the one to judge and implement it. So that's all I have to say. Yeah, back to you.
Thank you so much, Jack, and thank you, Leonila. I'll move on to the closing remarks. As we close today's session, I would like to extend our thanks to our speakers for their valuable insight, and also to the FIP team for their dedication in making this series possible, and also to our engaging audience for their participation and contributions. Thank you so much. And there will be a closing remarks. I would like the speakers to give like a 1-minute remark before I move on to the last few slides before we close the event. Charlie, can you go first? Just 1 minute closing remarks, what the audience should go on with. Yeah, thank you.
Oh, I think we need to think from the patient's perspective, from the public's perspective, to increase the health literacy, and the participant and all of us give us many great strategies to improve the health literacy. Yeah, thank you.
Thank you so much, Charlie. Jack, can you go next? Then Leonila would go
Yeah,
after
sure.
you.
Thank you, Grace. Well, I think from my observations, as well as what I see, the responses from all of you, my colleagues, is that we cannot look at health literacy as a side project. It is actually something important. It has to be at the center of our pharmacy practice. It is the foundation of a healthier and more resilient community, and we are the most accessible healthcare partner in the community. You don't need an appointment to come to see a pharmacist in the community. You can just walk in. So we are uniquely positioned to actually be a big driver for this. So again, but one more thing is that I think all of us needs to be here in it together. It takes a village to get something done. Governments, practitioners, communities, technology, everything has to come in. So keep up the good work, and hopefully we can continue the momentum to improve health literacy. Thanks so much. Back to you, Grace.
Thank you, Jack. Thank you. Yeah, over to you.
Okay. So I would just like to thank our participants, our fellow pharmacists here on board, for their very active participation and interaction. First, I'd like to thank FIP for bringing this initiative. Now, Grace and Albina for facilitating this. My fellow sharers of the discussion, Charlie and Jack, and most importantly, I will repeat, our participants were very active in giving what they have in mind relative to how we could improve health literacy, which really proved that there is so much a pharmacist can do to improve health literacy of the people residing in certain communities. After all, pharmacist is educated and trained more to do more. So again, thank you.
Thank you so much, Leonila. Moving on. So if you have any comments, suggestions to improve our events, please scan the QR code and we'd love to hear from you. So just to emphasize the call to action as we wrap today's session, let's take this conversation beyond the screen. Use what you've heard to inspire action in your pharmacy, community, or classroom. Please share these ideas with your networks, start local initiatives, and advocate for policies that strengthen health literacy and equity. We can turn today's insight into lasting change, ensuring no one is left behind, and definitely provide better healthcare for all. So for the event, To access this recording today for today's session, please, you can see our page at events.fip.org and also check for upcoming digital events. Before we close today's session, I would also like to highlight the FIP World Congress, which will take place in Montreal, Canada from 30th August to 2nd September 2026. The theme for the next event is One Health, One Pharmacy, Bridging Science, Practice, and Education. We warmly invite you to join us for this global gathering of the pharmacy profession. For more information and updates, please visit the Congress website at montreal2026.fip.org. or simply scan the QR code on the screen. The 2026 World Congress would focus on 3 sub-themes: integrated health, innovating with purpose, and collaborating for equity. We also encourage you to keep an eye on this important date. Abstract submission will close on 18 March 2026 with review outcomes from 17th April. Early registration will close by 3rd June 2026, and the second registration deadline will close by 12 August 2026. Thank you so much for joining us today for this session, and we hope you learned something new.